All right, good morning, everyone, or good evening, depending on where you are in the world. I know that it is a different time. Welcome to our virtual information session, Healthcare in the USA. My name is Katie Russo. I am the Assistant Director for Intercultural Programs here at UT Dallas. And so before we get started, I'm going to go through some event logistics. You can see and hear us, but we cannot see or hear you. And you will be able to ask us questions in the comment box on the right side of your screen, but we're going to turn that on at the end of the session. So right now it's not turned on. Towards the end of the session, we'll turn that on so you can ask questions. This way you'll be able to listen to the session. You might get your question answered right now while you're watching the session. If you don't, I recommend just writing it down and then you'll be able to ask that question later. Closed captioning is available. Look for the CC button on the bottom right of your screen. It's available in multiple languages, and so if you do need that extra language support, you can turn that on and you'll have words printed at the bottom of your screen to have that language support. Next slide, please. Okay, so today we have healthcare in the USA, and before I introduce our presenters, I want to share a little bit about some cultural aspects of healthcare in the USA. So I know that you are so excited to come to UT Dallas and to the US because UTD hosts about 4,000 international students from over 100 countries. So you are joining such a multicultural campus with very rich traditions, values, and cultures. So that's why I just wanted to take a few minutes to talk about some of those cultural aspects when you're coming part of our UT Dallas community. So when we talk about our own health and the health of others, there's a lot of cultural differences that play a role in the way we manage our health and communicate different aspects. So one of those aspects is health information privacy. In the US, health is something that's very private, as opposed to other cultures where people might easily share about their health conditions or health care, things like that. So asking people about specifics of their health condition or different aspects of their health is not really considered appropriate here in the United States. So I'm not going to go up to my coworker and ask them, well, why were you sick yesterday? Why didn't you come to work? So it's not really considered appropriate to ask those types of questions. So it's not something that we ask unless they voluntarily share that information. Even at the doctor's office, this is something that's considered very private. The doctor will not share your healthcare information with other people unless you give them permission. So for example, when I go to my doctor, I have to sign a paper that says, yes, you are allowed to give my healthcare information to these specific people. And that includes my husband, maybe my parents, if I want them to share that information with my parents or somebody that I'm living with. Legally, they're only allowed to provide healthcare information or health condition information to me and only me because I'm an adult, and I'm the only person who is responsible for that information. And so that's that trickle down effect, is we don't really share our private health information with other people. And so just keep that in mind when you're talking to people. You are more than welcome to share your health information with others if that's something you feel comfortable with, but we don't necessarily share that information with other people. And so it's not always considered polite to ask people about their health conditions. And similarly with communication, those communication styles might differ. So you've probably already seen this. So communication styles differ across different cultures. I think that's something a lot of us know. So they're very different from country to country. The predominant styles are different, obviously not with everybody, but in general, one country's communication style can be different than another country's. Something that you will see is that doctors and healthcare professionals in the United States are going to typically be very direct in their communication style. So when they communicate with you about your health, they will be very direct, and they might say something like, you have very high cholesterol, so you need to change your diet. And that maybe you might think that's rude, or you might be a little bit offended by that. But the reason why they do that is because they care about your health, and they want you to be healthy, and they want you to be safe, and they want to make sure that you understand exactly what procedures need to happen in order to make sure your health is good. And so this is something you should be very prepared for, is that the doctor will be very direct and give you very specific instructions. So just keep that in mind when you're coming to the United States and you might go visit the doctor or a hospital or a clinic, is communication is very direct and very procedure-like, and they have very specific instructions. Something else, so COVID-19, right? We're all learning worldwide how to navigate this pandemic. And so we've seen kind of across the world how the world is reacting to it. And we're going to learn a little bit more with Lee from the Student Health Center, but some things to keep in mind at UTD, vaccination status. We should not be asking anybody what their vaccination status is. This is something that we keep very private. So it's not required at UTD to be vaccinated, and we shouldn't ask. So you're welcome to tell someone if you are vaccinated, that's your personal choice, but I should not be going up to a student and say, hey, are you vaccinated? No, absolutely not. That is absolutely inappropriate. That's not okay for me to ask unless they choose to tell me. And the decision to wear a mask. So UTD follows CDC guidelines and encourages people to wear a mask, but I cannot ask someone to wear a mask. That is a policy. Something else, and this is similar to communication styles, is the sensitivity about social distancing. So people might choose to social distance, so keeping that 6 foot or 2 meters, I believe that is, distance, because they want to maintain safety. So they might be very direct in asking you to stay away from them. And they might say, oh, please don't get any closer, I'm social distancing. Try not to feel offended by that. So everyone has the right to choose how they are social distancing or not social distancing, and choose how they're taking care of themselves and maintaining that safety. And you have the right to ask for people to social distance from you. And so you might have people who are asking you very directly to keep your distance. For example, I have a neighbor in my neighborhood. When I go on walks and she's walking her dog, she has asked me, please do not come up and pet my dog. Please, I'm social distancing. And so she tells me that every single time. And she's been very direct with me, and that's okay. And just remember, it's not against you. That person is maintaining their safety, and they're being very direct, and they're trying to make sure they're keeping me safe as well. So they're keeping you safe by maintaining their social distance. So these are just some cultural factors about healthcare in the US that might be a little surprising to you. It might not be something that you've experienced before. And so we wanted to make you aware of them before you come here to the United States and you're a little bit surprised. Okay, so I'm going to introduce our next presenter, Brenda. She is the Student Insurance Program Coordinator, and she's going to talk to you all about student health insurance. So I will turn it over to Brenda, and she is all set to go.
Thank you, Katie. Okay, can we go to the next slide, please? Okay, one more. All right, so today I'm going to be talking about the student health insurance. In particular, I'm going to cover some common terms. I'm going to go over our medical plan, dental plan, discuss our premiums, and then go over some of our waiver processes. I'll also cover some advantages of having SHIP, another word for student health insurance plan. And then Dr. Aubrey is going to go over the UTD Health Center and important information, and then at the end we'll give you our contact information. So go ahead and next slide, please. So On the screen, we have some common terms you'll be hearing whenever you're dealing with insurance in the United States. So this pertains to our plan and any plan that you encounter while you're here. So a common term is a deductible. A deductible is a set amount that the insurance and the insured have decided is how much you're going to pay for your own care out of pocket before they start splitting everything with you. So later in our presentation, we'll go into more detail on our plan benefits, but an example of this is our plan's deductible is $350. So you will pay $350 of your own care. That could be testing, it could be, it should not have a timer, sorry. So like I was saying, the deductible is what you're going to pay out of your own pocket. Once you pay this amount, then everything else is going to be split, 80% covered by the insurance, 20% covered by you. Moving on to the copay. The copay is the set amount you're going to pay for specific services. For example, we have a copay for our medication. Certain medication are going to have a certain cost. For our generic, it'll be 15. Our name brand, it'll be 30. And again, we'll go into more detail on this later, but it's just a set cost that you'll pay every single time for certain services. Our co-insurance, as I mentioned with our deductible example earlier, once you meet your deductible of $350, everything else will be covered 80-20. That 20% is your co-insurance. So that's the percentage that you're going to pay for your coverage. Moving on to in-network versus out-of-network. In-network means that the doctor or doctor's office you're going to accepts your insurance plan. They accept, for our plan, it would be Blue Cross Blue Shield. So they accept Blue Cross Blue Shield, and that means you get all of your benefits. So you would get everything. So everything you would get done after you meet your deductible would be covered at 80%. Out-of-network is a provider that does not accept your insurance plan. Depending on your insurance plan that you've purchased, you may or may not have coverage for this. Our particular plan, we do offer out-of-network coverage. That just means that you're going to have a smaller percentage of coverage. For in-network, we have 80%, out-of-network is 60%. So in-network, they accept your insurance. Out-of-network, they don't accept your insurance. Moving on to PPO versus HMO. So PPO is a preferred provider organization, and then an HMO is a health management organization. The main differences is that a PPO has a large network of providers usually, and you do not need a referral to go to your doctors. So what you would do is if you feel you need to go get someone to look at your foot, you would go directly to that specialist. For an HMO, it's typically a smaller network. It's only particular doctors, and anytime you want to go to a specialist, you must go to your primary care doctor first and then get a referral, and that would be every single time you need to go to a specialist. We are lucky that our plan is a PPO, so you do not need a referral. Moving on to EOB. EOB stands for an explanation of benefits. This is a document you will typically receive once you get a service done. Let's say you go to the hospital and you had something done, you'll get this document later in the mail. It's not a bill. It's just letting you know what the breakdown of your insurance coverage was and how much they covered versus how much you have to cover later on. Again, it's not a bill. It's just an explanation of what that service is going to look like in terms of the money. Next slide, please. Okay, and so a little bit about our medical plan. Our student health insurance plan is managed by Academic Health Plans. This company collects our collects our money, and they keep track of everything, but the coverage is through Blue Cross Blue Shield. And in particular, for international students, if you have an F1, F2, J1, or J2 visa, the UT system requires you to have student health insurance. Once you enroll in credits, this fee will be put on your tuition, and you would pay for your insurance at the same time that you pay for your tuition. This wouldn't apply to us here, but if you were a domestic student, which means any other visa besides F or J, then you would not be enrolled in the insurance automatically. You would have to go onto the website if you wanted the insurance and enroll manually. Through the website, you would select either a payment plan or paying in full. Next slide, please. Okay, so a little bit about our medical plan. On the screen is an explanation of our benefits. For in-network, we have a deductible of $350, as I explained earlier. What that means is that after you pay $350 of your own treatment, then everything's going to be split 80-20. You would cover the 20%. And then we do have copays, like I mentioned earlier. For primary care, it'd be $20. For a specialist, it'd be $40. For urgent care, it would be $35. And then we also have copays that pertain to our medicine. For generic brands, it'll be $15. Non-preferred, it'll be $30. Non-preferred would be $50, and then preferred name brand would be $30. And then any specialty medication will get the same coverage as the rest of your other benefits. So you would cover 20% and the insurance would cover 80. One really good perk about the student health insurance plan is anytime you visit the health center, anything you get done there is going to be covered at 100%. The health center is a primary care provider, so they can provide you with your annual visit, women's health visits, and you can get a lot of services done there. Again, anything you get done there is going to be covered at 100%. The copays and deductibles only apply when you go off campus. Next slide, please. Okay, so a little bit about our dental plan. Our dental plan is also going to be through Blue Cross Blue Shield. Our dental plan differs from our medical in it is not mandatory. You will not be put on the dental plan automatically, and it's not going to be put on your tuition. If you want the dental plan, you would go onto the Academic Health Plan's website and you would enroll using their resources. You would pay for that insurance directly through the portal. The dental does not renew automatically each semester, so every semester you would like coverage, you would re-enroll online. Next slide, please. So a little bit about the dental plan. The dental plan is it's a very basic plan. We have a deductible of $75, an annual maximum of $1,000, and then pertaining to different treatments, there is a different co-insurance, and those can be seen on the screen. A little bit about the dental plan is it's very basic, like I mentioned, so we typically do not recommend this plan if you have a history of needing a lot of dental work. This plan will cover your annual visits and some restorative services, but for extensive surgeries, there will be a 6-month waiting period, which is not ideal for many patients. So students are welcome to find their own outside dental plan. We do not regulate the outside dental plans. It's up to you if you want to choose this one, or you can find your own if you'd like. Next slide, please. So the way that we charge our insurance is based on our semester. So for fall, the semester is going to be August 1st to December 31st. And the cost for this coming fall will be $1,338. For spring, the coverage is going to be January the 1st through May 31st, and then summer is going to be June the 1st through July 31st. These coverage dates are not going to change. Of course, the year would change, but for fall, spring, and summer, they're going to be the same term. And then every semester you enroll in your credits, you're going to get the student fee alone on your tuition. We do offer coverage for dependents, which it would be your spouse and your children. You would add them on the same portal that you would apply for the dental. And that's how you would do it. The spouse is going to cost you the same as the student, and then the children is going to be a little bit more, but with the child's charge, it's going to be the same cost regardless of how many children you have. Next slide, please. Okay, so our mandatory students have the option to waive our insurance. And the reason we provide this is because we want you to have some options. For you to be able to waive our insurance, you need to have an insurance that meets our UT system requirements. And that just makes sure that you have a plan of equal value to ours. The requirements can be seen on our screen, and you can also go to our website and learn more about it. But the most important requirements are on the screen. The dates of coverage for your third-party plan must be the same as the plan that we would offer you would be. So for fall, the coverage, the outside coverage must cover August the 1st to December 31st. It's okay if it covers longer, but those dates must be covered in order for you to be approved. Your plan must be PPACA compliant, which means it has to be a U.S. plan. And the three next requirements ensure that it's PPACA compliant. So it has to have unlimited maximum benefits, it has to have no pre-existing condition limitations, and it has to have a deductible of $500 or less. We also have a repatriation and medical evacuation requirement. However, if your third-party plan does not meet that requirement, it's okay. As long as everything else is met, then the university will provide you with this coverage so that you can at least get a partial waiver. The coverage for fall and spring repatriation are $40, and then summer is going to be $16. Again, if everything else is met except for the last two, then we will still allow you to waive as long as you purchase that repatriation and medical evacuation through the school. Okay, so you would waive your insurance by submitting a copy of your insurance card as well as an explanation of your benefits. An explanation of your benefits example would be a couple slides ago. I had a sheet that lets you know what was covered in our plan. It was the one that lets you know the deductible, the co-insurance. Well, we need something like that we can use to verify if you are eligible for a waiver. You would submit that in your insurance card to the UT Dallas/insurance/waiver website. For deadlines, you will check our website every semester, but we do send out reminders. For this particular upcoming fall, the waiver has already started. It was from July the 15th, and it's going to end on September the 17th. By September 17th at 11:59, you must submit your documentation. After that deadline, we will not accept any late waivers. If you ever have any questions about your outside plan being eligible, then you can send us an email to stuhealthinsurance@utdallas.edu. Okay, so moving on to waiving with UT Select. A lot of students here are going to be new incoming students, but in the future, if you were to become a TA, an RA, or a GA, then you have the option of choosing to waive our SHIP insurance with UT Select, which is the employee insurance. And with UT Select, it's an easy waive just because it's already an approved plan. You would just let us know, and that's easy to do. You also would have the option, if you ever became benefits eligible, to waive the employee insurance and keep our insurance. If you chose to do that, then you would receive dental and optical through the university. So to learn more, if you ever become eligible for benefits, you would reach out to Human Resources at benefits@utdallas.edu to learn more about that. Okay, next slide, please. Okay, some advantages of having the student health insurance plan are on the screen. I want to highlight these just because a lot of times there's going to be a lot of reasons, to want to waive, one of them being that the cost. Our health insurance may be more expensive than what you're used to, just because, in other countries, I'm aware that it's free. Unfortunately, we don't have that benefit here in the United States, but the plan that we're offering is a very good deal for the price we're offering it for. Typically, outside of the university, this plan will be way more expensive. Our plan per month, if you broke it down, would be $266, which is a great value, again, for the plan you're getting. So that is an advantage of keeping us, is you get a great plan for a discount. Our deductible is $350. That's a pretty low deductible. And as I mentioned, before you get to split the cost with the insurance company, you have to meet your deductible, which is why you want to have a lower deductible. It is possible to find a plan with larger deductibles, but that just means you have to keep paying more and more before you get to split it, which I would prefer a lower plan deductible. We also have a lower annual pocket maximum. Our annual pocket maximum is $6,600, and what that means is the most you will ever pay out of your pocket is going to be $6,600. Anything above that amount is going to be covered at 100%. And then our deductible does not apply to medications. As I mentioned, your medications are going to be a set price. It's going to be a set copay. Generic will be $15, and that'll never change. As I mentioned before, we also don't require referrals. We are a PPO, so that means if you feel you need to go see a specialist, you don't need to get a referral first. You can just go directly and make an appointment with the specialist. And then lastly, anything you do at the Student Health Center, if you have health insurance through our office, is going to be covered at 100%. The health center is a primary care provider, so you can get a lot of services done there. They also have a limited pharmacy, and Dr. Aubrey will go into more detail on the Student Health Center, but anything you get done there while you're on the insurance is going to be covered at 100%. Next slide. Okay, so I'll go ahead and pass it on to Dr. Aubrey, and she will be going over some of the services offered at the health center, as well as some important TB information and COVID-19 information.
Good morning, everyone. Definitely excited to have you all here and just to have an opportunity to talk a little bit more about some of the services offered on campus through the University Health Service Center. As Brenda stated, if you are currently enrolled or going to be enrolled in the university insurance plan, everything that you do in the health center is covered at 100%. The health center pretty much acts as a primary care provider. So you'll see treatments for depression, hypertension, asthma, also just diagnosis and treatment of general medical illnesses, minor emergency care, a routine checkup, physicals, different immunizations. We offer flu vaccine, meningitis, as well as TB screening. And then also we do some limited on-campus x-rays through a contract vendor that we use. So that allows you to have access to x-rays, ultrasounds, MRIs, and other specialized tests. And then again, like I said, we're primary care, so we are limited in some of the things that we're able to do. So some of those services that require a more specialized eye or a provider, we will refer you out in those instances. But in most cases, we want you to come to the health center first instead of going to the emergency room. One, to keep costs low, and then two, that way you kind of get that attention or get the attention readily available. It's readily available for you. So the services are there. We're located on campus, and it is convenient. Next slide. And so, as I said, we do offer immunizations, and I'm pretty sure you guys have heard a ton about TB screening, as it is one of the requirements that you will need upon arriving on campus. And so the TB screening is required for all persons born outside of the United States, regardless of the status of their application. The TB screening must be administered regardless of prior BCG vaccination, no more than 6 months prior to the first day of class. And the only acceptable TB screening option for international students registering for classes is the interferon gamma release assay, or IGRA blood test. The T-spot test must be administered and interpreted in the United States by a licensed medical provider. And those international students who do not complete a TB screening or who do not submit the appropriate documentation will not be allowed to attend classes until the TB requirement has been fulfilled. So as I'm talking about the TB screening, many of you have already registered for that, and you will have that done on campus. So you check quite a few boxes that I've kind of listed off here. And so as soon as that's done, as soon as we have the results, we have that in our system, and you will be free to go to class. If there is an issue, for whatever reason, say your results come back positive, you will be notified by the Student Health Center, and we will talk about what the next steps are in order for you to move forward in the process of completing your TB screening requirement. Next slide. And so COVID, also another topic that you guys are hearing a ton about. And so this is, so I'll talk about a couple of different things. Mostly some of the travel guidelines that are there. Vaccinated students, these students will be allowed to move on campus and get tested within 3 to 5 days of their arrival to the United States. We can ask them when they arrive to determine the testing time frame. Hours and days of testing site is in Blackstone will be provided. So again, you will be given the information as well as location so you can get tested on site. All international students will be required to be tested with a viral test 3 to 5 days after arrival to campus. Students may come to campus and be tested in Blackstone, Launchpad located next to Taco Bell on campus. So definitely in the dormitory area, there is a location that will be open to our international students. So you can arrive on campus within 3 to 5 days of your arrival, because there's a 7-day quarantine period, but within 3 to 5 days of that, you will need to get tested. The results are usually back within 24 hours. So that's kind of nice too, because that way you don't get further delays with getting everything taken care of. Students will self-monitor for COVID-19 symptoms, isolate and get tested if they develop symptoms, and then students will be recommended to follow all state and local recommendations or requirements after travel. And I do want to say this, Katie also mentioned this at the very beginning. Our office, as well as any functions related to the health center, will require you to wear a mask. It is the nature of what we do, and we want to make sure that we keep everybody protected when you're in our healthcare setting, as well as when you're being tested or vaccinated for COVID-19. Next slide, please. And so this information is for non-vaccinated. These students will not be allowed to move on campus. However, we will not know who they are because we cannot ask vaccination status due to privacy. We will inform all incoming international students that if they are not vaccinated, then they must follow the procedures outlined below. They will not be allowed to move on campus and must find alternative locations, optional hotel sites listed within the email. All international students will be required to be tested with a viral test 3 to 5 days after arrival due to arrival to campus, and they must stay off campus and self-quarantine for a full 7 days after travel. So that's one similarity that you will see between vaccinated and non-vaccinated. Everybody has to be tested. Students may come to campus and be tested again in the Blackstone location. If a student tests negative, they will be required to stay off campus and self-isolate for the full 7 days of the arrival to UT Dallas. And then if a student tests positive, they must remain isolated to protect others from getting infected for a minimum of 10 days from the positive test. Again, I know this is a ton of COVID information. It will be shared with you all. I know this information is coming directly from housing, specifically for those individuals that will be living on campus, but then also it speaks to precautions that you need to take if you're living off campus as well, because you want to keep yourself as well as your neighbors safe during this time. Next slide. And so before I jump into the contact information, I did want to share one additional thing in regards to COVID vaccinations, because I know there's a ton of questions about this. COVID vaccinations will be made available to students. We are still developing the dates, and for those that are coming on campus for TB screening, we're going to try to have those vaccinations available at the time that you're getting screened for TB. I think it just makes it really easier. And then also just having it all in one place. So those students that would like to be vaccinated, we are working to make sure that those vaccinations are available within the same area that you will be receiving TB screening. Outside of that, there will be 2 additional dates. August 22nd and August 25th will be 2 additional dates in which COVID vaccinations will be available. Again, much of this information is very, very new. So there is communication that's being developed, and you guys will see emails and you will see information on social media just to remind you of the services that are available. But we are very excited to see you all on campus this fall. We're excited to make sure that we have these services available for you. I know you probably have a ton of questions because you got a lot of information in a short period of time. So I just want to briefly go over our contact information, and then I will pass it back over to Katie. Brenda, again, our student health insurance office, the phone number here is listed where you can reach her, as well as email. I think you'll probably get a faster response via email because we are getting slammed with phone calls. But then also there's a lot of direct information that's very helpful, and it's located on the student health insurance website. And then there's also information there as well, more information about the health insurance plan, which is through academic health plans and their information and phone number and website is located on the slide as well. And then lastly, student health insurance, the student health center, sorry, same main number. We just have different prompts where you can either get to the insurance office or the health center. And then our email address, same thing. It's easier to get a faster response by reaching out via email. And then all of the information in regards to services, locations, vaccinations that we offer, forms that you may need is located on our website as well. So again, like I said, I know a ton of information and I'm going to be quiet now so Katie can take back over and then we can answer any questions that you may have. Thank you.
Thank you so much, Lee. So yes, I believe that we have opened up our Q&A. So as I mentioned before, you'll be able to post questions in the Q&A section. And Tamara is going to post some information and going to be reading your questions, but you'll be able to type any questions that you have in the chat function. So questions that you have for Brenda about student health insurance, questions that you have for Dr. Aubrey about student health center, TB test, any questions you have, or questions you have for the ICP team about arrival in the US and general questions, please feel free. So we are going to be here to answer your questions. So I know this was a lot of information and you probably do have a lot of questions. So Tamara, I will leave it up to you.
Thank you so much, Katie. Good morning, everyone. We are just going to get right into it. The questions are coming in, and just as an FYI, the questions come in to the chat. We are able to see them on our end, and we will get the responses for them. And then some of them we will publish, which means that we will make open publicly. So if you don't see your question published, it doesn't mean that we haven't received it. It just means that we haven't published it. Okay, excuse me. So there's a question that says, will the TB test be covered by SHIP? SHIP.
Okay, so yes, the TB test will be covered by SHIP. The health center is holding TB clinics, so you can sign up for one of those dates. And anything, like I mentioned, done at the health center is going to be covered at 100%. So if you get the TB test done at the health center, you don't pay anything. If you get it done off campus, it's still going to have coverage, but you will have to pay into your deductible and your co-insurance. Next.
Okay, thank you. Okay, sorry, this headset is not working with my hairstyle very well. Okay, the next question says, how would SHIP work out the expenses in case I happen to encounter health issues that need outside treatment, like maybe an operation for impacted wisdom tooth?
Okay, so for for coverage for your wisdom teeth, you would need to purchase the dental insurance. Like I mentioned earlier, we do have a dental plan. However, the plan we have would have a 6-month waiting period for wisdom teeth. So in that case, if you know this is something you need done soon, I would not recommend our dental plan. You would be able to purchase your own outside dental plan and find one that's more convenient for you. Again, the wisdom teeth would need dental coverage, which is not what the student health insurance plan is. It's a medical plan. If you were to get a medical treatment done off of campus with the student health insurance plan, so something then you would have 80% coverage with a $350 deductible. So anytime you go off campus, you are going to have coverage, even if it's not at 100%.
Right. Okay. Okay, the next question says, will the insurance coverage start on October the 1st, regardless of the fee payment status?
So the coverage dates for fall are going to be August the 1st to December 31st, regardless of when you pay your fee or when you enroll. Those dates are not going to change.
Okay. Okay. Next question says, do I need to have a negative RT-PCR report before appearing for the TB test?
So the answer to that is yes, because that is referring to the COVID testing. And according to travel guidelines, you need to be tested within 3 to 5 days of arriving in the US. And so we would want to make sure that you have your results. And so if you decide to get that done on campus at the Blackstone location, those results are available within 24 hours. So you'll be able to have a copy of your results and share that with us upon arriving to the TB screening. That way you keep everybody protected, because if you do come back positive, we definitely don't want you to come to testing. We'll make arrangements to get that satisfied at a later date. We want you to be able to isolate and then protect those that will be also visiting that same location.
Okay, perfect. Okay, the next question says, how does reimbursement in health insurance work? I'm not quite sure what this question is referring to. I don't know, Brenda or Leah.
Yeah. Okay. So the coverage dates for fall are set. So August 1st to December 31st. So if you were to send me an email today, I would provide you with a coverage letter for those dates, and it'll state the coverage information on there. So ideally, as long as you get that information, you won't need to submit anything for reimbursement. You would provide that coverage letter to that provider, and they would automatically apply your benefits. Now, let's say you went to a doctor between August the 1st and December 31st, and for some reason you didn't have your insurance information, then you can submit a claim for reimbursement. And you can send us an email to STU Health Insurance, and we will provide you with those reimbursement claim forms. But that typically only happens when you, for some reason, did not provide your insurance information to the doctors. Okay. Hopefully that answers the question.
Yes, thank you, Brenda. Okay, the next question says, what is the process to get gap insurance? I'll be arriving 1 day earlier than when insurance kicks in.
Okay, so what I would have you do is send me an email to stuhealthinsurance@utdallas.edu. We do not, through our office, sell gap insurance, but Academic Health Plans does have a qualifying life event form. You would sign up through the website. Again, send me an email and I can send you the steps for that. And you would sign up, and unfortunately they wouldn't be able to do that 1 day though. You would have to get month coverage for the whole July. Which in that option, you may just want to wait till the next day, but that is the only option they offer for gap. And when you enroll, you would also provide a copy of your visa arrival date just as confirmation.
Okay, thank you. Okay, next question says, can I get tested on the day we arrive if I am arriving late? Please answer. I'm not quite sure what test they're referring to. I don't know if it is the TB test or the COVID test. Can I get tested on the day we arrive if I am arriving late? So
I think maybe I can address both and try to head it off that way. For TB, if you are arriving late, I would say notify the health center, because what we're doing with COVID, we want to be really cautious and really intentional with appointment setting, so students come at the time that they're of their appointment slot, so we can control the volume of students that are coming in. Because again, we don't know people's status when they come in that room, and we're, of course, by law, we can't share with everybody else. So we definitely want to be mindful of those precautions, mask wearing, and just be really intentional with social distancing. So if you could give us a call with the TB in regards to TB, so if we need to shift your testing or put it on another day, we can definitely make those accommodations. In regards to COVID, remember, as long as you're doing within arrival of 3 to 5 days, because you have that 7-day quarantine period, and within that 3 to 5 days of arriving, you need to get tested. So yes, I believe, if I'm not wrong, I believe the COVID testing is going to be on demand. They're going to be expecting that volume. So as soon as you arrive and want to know where the COVID testing is, they will be able to direct you there. So I think I addressed both of those questions. So if you're late for COVID testing, you still should be able to go straight to Blackstone and be tested. If you're going to be late for TB, we would prefer that you contact the Student Health Center, because we are doing that according to appointments. So then that way we can reschedule you and get your TB screening done in a timely fashion.
Okay, great. All right. The next question says, how soon can I expect the TB test result to be available and reflected on the Galaxy portal after I take the test?
Okay. So the TB screening, if you do it with our office, it's going to take anywhere from 48 to 72 hours for us to get those results. And as soon as we get those results, it comes back into our system and you'll be able to see it. So at least allow 3 to 4 business days before you check your Galaxy portal. Just like everything else, everything has delays. So definitely please be patient with us. We're looking at upwards of, 1,000 students or more that we're all screening. So there's going to be a lot of people that are really nervous about their results. But if you do not hear from us in 3 to 4 days, definitely jump out there and check your portal to see if the results have been posted, not the results, just to show that your TB screening has been fulfilled. You will have access to the patient portal, which is a system through the Student Health Center. And if you've already registered for TB, you've already experienced our patient portal. So you'll be able to log right back into that same link and look at your results. So that will be a place for you to look at immunizations and any services that you get done in the Student Health Center. So you'll have access to your medical record there. So if you do hear from us within that 3 to 4 business day period, more than likely we're calling to let you know that your results are either abnormal or positive. And again, that does not mean you have active TB. It is the precautions that we see something there and we want to take the next step, which is usually a chest x-ray, and we do those in the office as well. And those are also covered at 100% by your student health insurance. So again, we want to try to take care of everything within our office, so we're not having to push you out into the city of Richardson and try to get you to navigate an area that is very new to you. So those two things will definitely be able to be handled within the health center.
Okay. All right. Next question says, when will the TB test screening be done for students who are arriving for the fall, the second 8-week period?
We have not set up that time yet just because it's so far out, but we will notify, we will send a notice out to students. More than likely, that's something that we will do within our office. And again, appointment schedules only, just because everything will be in full swing by the time you guys get there. And so it'll be kind of hard to have a separate location, but we will send some information out. Maybe the notification is the same thing with most students, just log on to click this link, log in, schedule your appointment, and we will definitely get it handled that way. But more information about those students arriving late in regards to TB screening will come in the upcoming months once we get a little bit closer, so we can kind of secure a date and time and then really be more specific with the details surrounding the TB screening.
Okay, perfect. Okay, next question says, how do we go about transferring a repeat prescription that we have at home to the United States?
So if you can, one or two ways, you can either get your prescription back home written, so you can get it, so it depends on the type of prescription. So if it's something that's more dealing with a specialty or a specialist, we usually like to have the student go ahead and connect with someone in the Richardson location. Again, remember, most specialties is something that's not going to be handled by the Student Health Center. So if we're speaking something like a nephrologist, someone that deals with kidneys, or something that's more maybe mental health related issues, we want you to connect with a specialist in the Richardson location. One, so you have that continuity of care. It is advised that you get a copy of your medical records and share it with that new provider so they know your medical history. And then that would allow them to do a continuation of your prescriptions. If possible, before leaving home, maybe it may take a little bit longer to acquire that relationship. See how much of a refill you can get from your doctor. So maybe they can allow you 2 or 3 month prescriptions to travel from your home country to the US. So you have enough to last you up to 3 months until you locate a new specialist. But again, make sure you have a copy of your medical records. Definitely go ahead and jump on the internet and see what specialist is available. If it is something that's not specialist related and it's something that will be handled by a primary care physician, we ask, again, medical records, get those, bring them to the student health center so we can go ahead and put them in your medical record with the university. And then the provider that you would see will be able to review your medical records, again, look at the history, and then determine how the prescription needs to be handled from that point of view. But it will be, of course, you can't really transfer from a different country to the United States just because the differencing of the medical systems and things of that nature. But it would be best to kind of make a connection either with the health center or a specialist within the community.
Great. And if I could also add to that, if there are medical records that are not in English, I would say maybe that would be something that a student would want to go ahead and have translated, because, you know, unless maybe you do find a medical professional here that is able to, well, even if you find a specialist that is able to kind of, you know, read and write in a language other than English, there could be other staff in the office that do not. And so I would just recommend getting those documents translated. I don't know if there's probably maybe some kind of a system and, you know, to go about that, but just something else to think about. So.
Thank you for adding that. I totally forgot about that. And I was going to say, I know we have a company that we work with internally, Language Line, and they can do some translations with medical records. But again, very good point, because if you go with someone in the community, they are going to ask, or they won't accept the records because they're in a different language.
Yes, exactly. Or even the prescription is written, you know, in different language with, you know, different drugs, then yes.
Yes.
Perfect. Okay, so this other question says, do we need to take a COVID test before international student orientation? Does it need to be RT-PCR test or the rapid COVID test? Now, I can answer in regards to orientation. In regards to orientation, there's no requirement as to your COVID testing or proof of a COVID test. So basically, a proof of COVID testing will not be asked of you when you attend orientation. Now, whatever protocol you need to follow in regards to immigrating to the United States, and, you know, whatever quarantine you need to follow or not follow because of your vaccination status, that is a different thing that has to do with, you know, whatever the federal government or, you know, the CDC is asking of people who are entering the country. That's separate. But for intercultural programs and international student orientation, we will not be asking students to produce documents to verify vaccination status or COVID records of any kind.
And just to add to that again, if you're following the protocols, more than likely you're going to be screened before you even arrive to international orientation because of that 3 to 5 day window. And you are I think what we're offering on campus is the PCR test. But if you have access to the rapid COVID test, I think there's not a delineation that they're saying you have to have one or the other. It's just that you have to be screened. So I know on campus we are offering PCR.
Okay. Okay, the next question says, when do we pay our insurance fee, as we are receiving tuition fee notifications, but not about remaining payments?
Okay, so the insurance fee is put on your tuition. So whenever you pay your tuition is when you pay your insurance. It's just added on to that. There's no separate date for the insurance. So whatever that deadline was already given by the bursar's office also applies to insurance. I think that's what you meant.
Okay, thank you. Okay, next question says, can you please tell me which meningitis I should take from my home country? MCV4 or MPSV4 or both?
I want to say, because that's not that's something that's accepted by a different office, but I want to say, I know they accept the MCV4. I need to look up the MPSV4, and I can look that up while we're on here and give a response, because once you receive this vaccination, it goes to the registrar's office, and so they review that. I can take a look at that and give you a response, Tamara, and then we can put it back out there.
Okay, yeah, sure,
Okay.
Thank you. Okay, the next question says, okay, I think we have already addressed that. I am arriving on the evening of the 19th, I assume this is August the 19th, and have only one shot of vaccine. So I guess they received one shot of a vaccine.
Mhm.
If I'm unable to get my second dose, would this vaccine be available on the campus or around the campus? And they noted that the vaccine that they have is called Covishield.
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 I think that, hold on, because I know they have the different the different names for them.
Covishield.
Covishield is a different name for, I have my little document.
So I just Googled it. It appears to be Oxford AstraZeneca.
Okay,
Covishield.
so AstraZeneca, so that specific vaccine we do not have in the United States. The vaccines that we have in the United States is going to be the Pfizer vaccination, Moderna, and Johnson & Johnson. Those are the only three that have been World Health Organization approved for the United States. If you are not able to get your second dose before you arrive in the United States, what you will have to do is wait 28 days. If you're still wanting to get vaccinated, you will have to wait 28 days from that first injection and then start the series all the way over. So you would, if you decide to do Moderna or Pfizer, then you would take the first vaccination of Moderna, you will wait 21 days and come back and get the second one. So, I mean, it does kind of put you in, this weird gray area, but unfortunately, since we do not have a vaccination that's compatible to the one that you have already received, you would have to start the series all the way over.
Right. Okay, next question says that this person has a question about the dental plan. What is the cost and will it cover retainer, for example, or just basic cleaning? So they're asking about the dental plan and is it just like basic cleaning, or if this person has like a retainer or maybe braces or some other features, if that will be covered.
Okay, so the first part of that question, for fall, the cost is going to be $106. Like I mentioned, you would enroll on the website, so you would pay that directly through the website. Unfortunately, the dental plan offered through our school does not cover orthodontics, so that means no braces, no retainers. It's a very basic plan, like I mentioned earlier. It would cover your basic annual cleanings and restorative services like cavities. But braces would not be covered.
Okay, thank you. Okay.
I'm sorry, Tamara, to interrupt.
Yeah.
Can I go back to that one student that had the question
Sure.
about the meningitis?
Mm-hmm.
Okay. So this information is also on the registrar's website page, but they do accept the MIN ACWY, the MCV, so not the MZ4. I misspoke on that one. It's MCV, but then the other one that they shared, MPSV4. Is there any way I can copy this and put it in the chat, or?
Sure. Yes. Okay. Yes, definitely.
Yeah, you should have access to the chat, Lee.
Okay. Thank you. Sorry about that.
Yes, no, thank you for that clarification. Thank you. Okay, there's another question here. It says, I'm not sure if you have already mentioned this, Brenda. It says, will the COVID test for international students be covered under the student health insurance plan?
Yes, it will. Currently, COVID testing and COVID treatment are covered at 100%. Well, COVID testing is covered at 100%. COVID treatment is covered just like anything else.
Okay. Okay. Okay, here's a question from Fatime. It says, how can I know about special medications and if insurance supports them or not?
Okay, so if you have a particular medication you would like us to verify, you would have to send us an email to STU Health Insurance. We will contact Blue Cross Blue Shield and verify for you. I do want to note that a lot of times I've been getting emails about certain medications and it may be covered but under a different name, just because in original countries, it may have a different name, but it's still going to be, if we say generic, it's the same thing. But if there's a particular brand, yeah, you can contact us and we will let you know.
Okay, perfect. Okay, here's the question, and to this person that asked this question, I think Lee just kind of addressed this, but this person is saying, if I'm vaccinating with Covaxin, can I take a vaccine which is approved in the US once I arrive in the at UTD? So Lee just answered that question in regards to the person that was saying that they were vaccinated with Covishield. Covaxin is not, as far as I know, I'm not sure if that is an approved, a WHO approved vaccine. So it's I would think that your situation would be the same as the person that got the Covishield.
No, I agree. That doesn't sound like one that I'm familiar with. That sounds like it would be World Health Organization approved. So again, it would be the same thing. If you are not able to receive your second dose before arriving in the United States, and you still would like to be vaccinated, you can be vaccinated with one of the vaccines that have been approved for use in the United States. You would just need to have your first dose at least 28 days from the first dose of the vaccine that you've already had. And so whether that be Moderna or Pfizer, once you receive your first dose of either one of those vaccines, then you would come back in about 21 days to receive the second dose.
Perfect. And also in the chat, I do want to mention, I posted it. It was a lot of information, but if you are in the chat and you maybe scroll up a little bit, I put a bunch of links there. They're kind of, jumbled just because of the format, but not jumbled. They're just very compacted, but there are some links there, and there's a link there to the CDC, and you can view the CDC approved vaccinations. There is the list that is available there so that you can review that list and see whether or not a vaccine that you have already taken or are intending to take pretty soon is on that list, so that you can kind of know what you may be getting into if you're trying to look about getting a first dose outside of the country or a second dose, etc. Okay, here's another question. It says, do we pay for the student health insurance every semester? Oh, Brenda, you were...
I was about to type on it. Yes. So depending on your enrollment in credits, once you enroll in credits, that fee is automatically put on your tuition. The fee for the insurance is based, again, on your enrollment, so it is semester to semester.
Okay, perfect. All right, here is another question. It says, if I take the insurance for my first semester, can I get it from somewhere else for the other semesters?
So yes, you can. We have a open waiver period every semester. For this current fall, it's going to be from July the 15th to September 17th. During that time period, you would submit proof of a different insurance. We have one of these waiver periods every semester. The deadlines do change a little bit, but we will send you reminders. As long as you submit your proof of having a third-party insurance that meets all of our waiver requirements, then you would be waived. One thing to note about the waiver is it's not automatically renewed. So every semester you would like to waive, you must keep submitting your proof.
Oh, okay. Okay, good to know. Okay, here is another question. It says, is the student health insurance mandatory? Can we opt out? And can we have a different U.S. insurance from outside of UT Dallas, which you kind of just spoke to? But.
Yes. So just to rephrase it, yes, it is mandatory for F1, F2, J1, and J2 students. These are the only student visas that it is mandatory for. For these students, anytime they enroll in credits, they will be automatically enrolled in the insurance. Any other visa status is optional. But for these students that it's mandatory, you have the option of waiving with another U.S. insurance plan, as long as it meets our UT system requirements and you submit your documentation before the semester deadline.
Okay, perfect. Okay, this other question says, correct me if I'm wrong, our fee structure mentioned $65 for the TB test. So is it paid by us or will it be considered in the insurance plan?
Okay, so I think we can add to this, but if you're taking it from the coverage term, so for fall it'd be August 1st to December 31st, then yes, the insurance is going to cover the test. If you're getting it outside of this coverage term, then you would be responsible for that fee.
And just to add, the price, the $65 price has changed and it's been updated on our website and is actually $80 now. And again, to coincide with what Brenda said, it is going to be covered by the health insurance if that's what if you are enrolled in the university health insurance. So you won't even see a bill. You'll show up to have your TB screening done and we'll take care of all of that on the back end in regards to following it on the health insurance to make sure that it's covered at 100%.
Perfect. Okay, here's another important question, as they all are. This says, is ambulance costs covered under the insurance plan?
Yes, so it's going to be covered just like everything else. You would still have to pay your deductible of $350. After your deductible, then you would cover 20% of the cost for the ambulance.
Okay. Excuse me. Okay. And just once again, if anyone is, I know people may be joining at different points, this session is being recorded and will be made available on the International Student Orientation page. So if you do need to catch this from the start, if you didn't, or listen to it again, just know that it will be made available. Just give us about 2 business days and we'll have it uploaded just in case you need to listen, because this is a lot of information to process. Okay, here's another question. It says, okay, I think we have already answered that. Okay, here's a question. It says, what are all the health checkups we need to do or go through before traveling to the US and after arriving in the US? That sounds like, if I can speak on that, in regards to health checkups, that sounds like that information would be communicated to you by the U.S. consulate that would be located in your, in whatever city you're having your appointment with. So if you're speaking outside of like a COVID situation, I know that sometimes for some visas, some people have to do like a medical checkup. And so that might be what you are referring to. I think if that is the case, your U.S. consulate would tell you whenever, if they do require a medical checkup from you, they would tell you and say, okay, these are the locations in your city or wherever that you can go and get a medical checkup done. And, they may even tell you like, these are the things that we're testing for, or these are the things that we're looking for. But specifically for F&J visas, I don't know if there are any medical checkups required, but if there are, they would be communicated to you by the U.S. consulate that's actually processing your visa. I don't know if anybody else wants to add to that. Or
I was gonna just add a few. I mean, there's not any requirements in regards to checkups by the university. Of course, the TB screening requirement, meningitis, those are things that are required by the university. But we also list on our website other recommended vaccinations, especially because if you're going to live on campus, it's not just you by yourself, it's you and hundreds of other students. And so we definitely want you to be protected in that sense. But outside of those things, there's not any real specific physical type requirements that the university has placed on the students to fulfill.
Right, that is correct. So on the university end, there's nothing on our end, but if the consulate is telling you something, then please make sure to follow up with that, because if they're telling you something, it's for a reason. And of course, you want to make sure to do it. Okay, there's another question here. It says, does getting cosmetic dental aligners, okay, so I guess maybe I'll rephrase it. So does the dental insurance cover getting cosmetic dental aligners?
So no, it does not. That would still be considered orthodontic care. And like I mentioned earlier, they don't cover braces or retainers, so that would not be covered by the dental. Again, you are welcome to find your own outside dental plan if that's what's more convenient for you. The dental is not mandatory through our office.
Okay, great. Thank you. Okay. Okay, another question about a dose of Sinopharm vaccine. Sinopharm, as far as I know, I don't believe it's one of those that are on the list of the CDC approved vaccines for the United States. So as we mentioned earlier, there is I put some links in the chat. So if you can scroll up to the chat, you can see a link. It says, I think it says CDC. What did I call it? Let me see, I can look. It says COVID information and check for which CDC authorized vaccines are accepted. So, and which vaccines are accepted by CDC. So please consult that list and then, make the necessary decisions and arrangements regarding that list. Okay, somebody has already asked that. Someone says after. Well, we have already answered that. Okay, a lot of these are repeats. I'm trying to find ones that are new. We do have a lot of questions, but a lot of them are repeated. So once again, a lot about the same thing. Can be done for students arriving. Okay, this question is about vision insurance. It says vision insurance, is it also available under the health insurance plan or is that separate?
Okay, so that is separate. Our office does not provide vision insurance. On the Academic Help Side website, which is the company that manages our plan, they do offer an optional vision plan, but again, it's not managed through us, so it'd be like purchasing an outside one. You are welcome to find your own outside vision, but that is one that I know it is available to our students through academic help plans.
Okay, thank you. Here is a question. I think if I understand it correctly, they're asking, they said, okay, they say, while paying for the tuition, well, maybe tuition and fees, automatically my health insurance fees are paid, right?
So yes, so once you register in classes, the SHIP fee is automatically added to your account. You can, if you were to ask for a breakdown, it would be on your other fees section. But yes, it's automatically included in the payment plan you sign up for, and it also has the same deadlines applied to it.
Okay, thank you. Okay, a lot of these are repeat questions. Okay, here's a question. It says, can I simply reschedule the TB test appointment on the health center website, or do I need to do it in Orion as well?
You should be able to, because in Orion, that just proposed the dates that were available for TB screening. So for the rescheduling to have an effect, you definitely need to do it through the patient portal link that you were sent. So you should be able to go in there and cancel your appointment and reschedule it. If it does not allow you to cancel, please reach out to the Student Health Center so we can do it on our side, but then you can just reschedule for another date.
Okay, thank you. Okay, so I do see a lot of questions that are in here about scheduling. People are kind of asking and saying, if I arrive on this day and if I, have, orientation on this day or something like that, so what I would recommend, once again, if you're trying to figure out scheduling, as I know a lot of people are trying to figure out their travel plans, if you if you scroll up to the chat, I recommend looking on the links that I put there. There are links that are there that are via the CDC, and they speak about what you need to do if you're entering the country from outside of America, and the timelines, if you're vaccinated with CDC approved vaccines, if you're not vaccinated. So please refer to that, because it's hard for us to, you know, look on everybody's individual schedule and say, I'm arriving on the 10th and then I have this and whatever. So my best advice is just to review that information, and then that is how you can determine how to kind of, you know, maybe space out your activities or space out your tasks that you need to complete, because it's a lot of different, it's the same question but in different ways. So if you read that information and see what is required of you, then you can be able to kind of form your opinions and create plan of actions for the things that you need to do. So hopefully that makes sense. Okay, moving on to another question. This question says, okay, it's a lot of these are repeat questions. Okay, here's a question. It says, is it mandatory to carry immunization records? Also, what vaccinations are we supposed to get before getting to the US? Well, we kind of spoke about that a little bit, but is it mandatory to carry immunization records?
I would say that it's helpful, especially when coming to the health center, or maybe you may go somewhere else and you're needing to acquire, you know, medical attention. It's always helpful to have that, just in case you're needing it for an internship or some kind of volunteer opportunity, to be able to share that. If you want, please feel free, if you want to share with the health center. We just take it and add it to your medical record. That way we have it on record with ourselves, but it is good to have a copy of it, because you never know how, in what capacity you may need it, or to show proof of vaccination.
Okay, thank you. All right, let's see. So someone is asking, someone says, I'm not sure why my questions are not showing up on the chat. They're all tagged as private. There's no option to make it public. So there are individuals that maybe that are responding to questions in the chat, just because we do have a lot of questions and we might not be able to answer all of them. So if your question is being answered, hopefully you'll accept the answer, whether it is answered to you privately or if it is being answered publicly. So hopefully that addresses that.
And Tamara, can I just interrupt to say, remember to just post your question once. So as Tamara said in the beginning, your question does not immediately get published to the entire group. It just goes to our team. And so we will see it. Tamara will read it for Brenda and Lee to answer. And then she will then publish it to the group to see. And so that's why you might not see your question immediately after posting. And so when Tamara's reading questions, she keeps seeing repeats. So you won't see your question immediately published. And so that's why it might take Tamara a little bit longer to filter through the questions, because she keeps getting repeat questions posted. So just post your question once. So it helps Tamara out a lot when going through these questions.
Thank you, Katie. Okay, here's another question. This says, I'm planning to arrive in the US and staying for 14 days in a different city other than Dallas. Can I take the COVID test after I come to Dallas? Okay, so this person is planning to arrive to the US and they're planning to stay for 14 days in a different city other than Dallas. Can they take the COVID test? So to this person, what I would say to you is, once again, if you scroll up, I posted some links in the chat. There is a link to the CDC website that has the requirements for what you need to do when you enter the United States, regardless of what city you enter the United States in. So just because you are coming to UT Dallas, you do not necessarily have to enter through DFW Airport or through the Dallas Love Field Airport. So it is best for you to follow those protocols that are given by the CDC for what you need to do when you enter the United States, and that is regardless of what city or state you enter through. So your port of entry doesn't have to be Dallas. Just follow the CDC guidelines for what you need to do whenever you enter based on your vaccination status. So hopefully that answers that question. Okay, let's see, trying to find a different question. Can I get, well, okay. Are the COVID, okay, so we have already answered that. Trying to find something that is new. Da, da, da. So once again, a lot of the questions people are asking, maybe some of the repeat questions that I'm seeing people are asking, they're saying, you know, I'm going to arrive to, you know, Dallas on this day, and, you know, can I get the test done on that day? So once again, consult the CDC guidelines in regards to what you need to do, what protocols you need to follow according to your vaccination status. That will help answer your question. Okay. Another question's about dentists. So here's a question from Hamida. This question says, do we have preferred dentists to go to under the health insurance plan?
So the health insurance plan is through Blue Cross Blue Shield. So you would want to have a dentist, find a dentist that accepts Blue Cross Blue Shield. You can always check the website to see a list of those providers, but typically as long as you contact the provider and make sure they accept Blue Cross Blue Shield, you can visit them.
Thank you. And also to add to that, we're able to provide a list of, you know, you can search as to which dentists are in your network. So it's more a matter of if someone is, you know, maybe in network, I would say, or out of network, right, Brenda? It's not so much maybe the use of like preferred, you know, a preferred person, but it's more, is this person within the network or out of network? Those are maybe some helpful phrases, right?
Mm-hmm. And then again, yeah, in-network means they accept your insurance.
Right, exactly. So yes, if you do need help, I have, you know, sought the help of medical practitioners, and I've gone onto our health insurance website and searched for practitioners that were in network to make sure that you know, whatever costs that I may need to pay will definitely be as low as possible. So looking for people that are in network is always great. And even if you contact an office, of course, the health insurance office is available. You can ask them questions. I do that a lot in terms of with my insurance, even if a doctor's office, if I ask a doctor's office something and they may give me an answer, I generally will call my insurance and talk to somebody and ask them again, just to double check, because at the end of the day, when you go to the doctor's office and you may sign something that's saying, you know, you are responsible for whatever charges are incurred. So if somebody told you something, you know, they told you something in error or whatever it is, well, if you took, you know, part of the service, if you benefited from that service, you can't undo it. So you will need to pay that. So just if you always want to double check if someone is in network or if a service that they're saying is being covered at a certain percentage or whatever, you can always double check by calling the insurance company. I call Blue Cross Blue Shield, which is our provider, quite a bit. They probably have notes on my account that says this person calls a lot, but I do because I always double check because things can be costly. So. Mm-hmm. Okay, let's see another question. I'm trying to look for questions that are unique to give Brenda and Leah a chance to answer things that that they have not already addressed and have not already answered. So it's going to take me a little while to get to those. Okay, well, this question says, do I need to be registered for a full course load to to make to I guess to be able to get to be on the health insurance plan during the summer semester?
Okay.
And if not, yes, sorry.
It's okay. So during the summer, well, to begin, anytime you're enrolled in at least 1 credit hour and you're one of these mandatory enrollment students, so J1, J2, F1, and F2, if you're in at least 1 credit, then you're going to be automatically put in the insurance. So for summer, if you are if you're enrolled in at least 1, then you're going to be enrolled in the insurance. But if you're not enrolled in any credits during the summer, you're not going to be automatically enrolled. But you can contact our office and we will help you enroll. So during the summer or any semester you're not enrolled in credits, it's not going to be mandatory, it's optional. But if you contact us, we will help you enroll.
Okay, thank you. Okay, here's another question. It says, I have paid the tuition and insurance fee, and I would like to know how I can get my health insurance number.
Okay, so you would send us an email. You can send us an email at stuhealthinsurance@utdallas.edu. And when you send us an email, provide us with your UTD ID number and we can help you get that coverage information.
Okay, perfect. Okay, let's see. Okay, we've already answered that one. Taking some other TB. Okay, here's a question. It says, if I am taking some other health insurance plan, will that cover the TB test screening on campus?
Okay, so the Student Health Center does not accept outside insurance. So the only insurance the health center accepts is going to be our insurance, so SHIP. Anything again done, if you're enrolled in SHIP, is going to be covered at 100%. As a student, you're still going to have access to the health center, so you can still get your TB test done there. However, you're going to have to pay for that treatment or testing directly out of your pocket and later make a claim with your own insurance on your own. Again, the health center only accepts our insurance to make claims. The health center does not make claims for other insurances. You can get the treatment and later request documentation to make a claim on your own, though.
Okay, thank you. Okay, just another announcement. The links that I posted in the chat are very much at the top. If you're looking for a timestamp, it was at 9:38 a.m. However, Katie just recently reposted at around a timestamp of 10:23 a.m. If you can see the timestamp for the travel guidelines for entering the country and the protocols that you would need to follow for that. So I highly recommend to please consult and refer to those links if you are currently trying to work out a plan as to when can I enter and do I have to quarantine or not, and how many days after can I take a TB test, and etc. etc. I highly strongly recommend to please read that information first and see if you can, kind of make your plans off of that. And if you still have questions after that, then please let us know. Okay, moving on to, let's see, other questions that have not been asked already. Let's see, okay, it's a lot of this is about, whereas, okay, no. Can I, okay, this question says, for non-vaccinated students, do we need to follow any restrictions after getting COVID negative report and 7 days of quarantine?
No, once you've done the 3 to 5 days, and if it's negative, so once you finish that full 7 days, you're done. So as long as it's negative and you've completed the 7-day quarantine, you are finished. And this is for unvaccinated, correct?
Yes.
Okay, so if you would like to get vaccinated, that option will be made available to you. Of course, we highly encourage it, but it is not required by the university.
I see. Okay, thank you. Okay, here's another question. So this is another one about immunization records. So we had a question about like health checkups, and maybe we spoke about recommended vaccinations, but this says, what immunization records do we need to upload onto the health center before flying to the US if we are 23 years and above?
There are none that are required, unfortunately. So I know meningitis for 25, 22 and younger if you're staying on campus. If you're at the 23 mark, there's not any that are required by the university. The only thing that falls in that would be the TB screening. If you just want to share your vaccination record with us, please feel free to do so. And you can upload that to the Student Health Center. And of course, that will be kept private and not shared with anybody.
Okay, thank you. Thank you. Okay, here's another question. It says, will they check our arrival date while attending international orientation? So for international orientation, this might be a good opportunity to just speak in general. For international student orientation, we are not asking for any kind of medical records of any kind. We do ask for a government issued identification. Typically, that is the students bring their passports. We do ask for a government issued identification so that we can verify that, you know, the person that is checking into orientation is the person that registered for it. But we will not be we will not be asking, okay, when did you arrive to America? Did you arrive yesterday? Oh, well, orientation is you know, was just a day ago. We will not be doing that. We do not have a system that is set up. We just only hope that students will abide by the guidelines for entering the country and all the things that they need to do, because these are guidelines that are being issued by the CDC, and the entire UT Dallas community is in the process of abiding by those guidelines: staff, students, faculty, children, spouses. So we just, you know, we just only ask and hope that if you are, you know, coming into the UT Dallas community, that we would all just kind of follow along with the protocols. But no, we will not be asking for any kind of proof of, you know, port of entry and the date and any of that information. But we're all doing our best to ensure the health, safety, and the lives of the UT Dallas community. So we just ask everyone to get vaccinated if vaccinations are available to you. If you know, and then I guess, you know, I guess I should say CDC approved vaccinations are available, and if not, and you are unvaccinated, then do the necessary protocol for unvaccinated individuals entering the country. Okay, let's see other questions that we may have. Okay, this question says, I have one dose of the Johnson & Johnson. Well, I think Johnson & Johnson is the one dose. So it says, I have the one dose Johnson & Johnson. I actually took it in the US. Should I present a negative COVID test at the airport, or just present the vaccination certificate, or just presenting the vaccination certificate will be enough?
I want to say, I think they're still, regardless of vaccination status, they're still requiring you to test. I know that's something that is the protocol that's out there. So regardless of vaccination status, vaccinated or unvaccinated, both individuals have to test for COVID.
Right. Okay. Okay. Okay, let's see. There's a recovered from. Okay, let's skip to another question. Sure. Okay. All right, let me scroll down some more to see if I can find some topics or questions that we haven't gotten to as yet. So general question, it says, is it mandatory to carry immunization records? Also, what all vaccinations are we supposed to get before entering the US? We have already spoken about that, as Brenda said. Brenda, if you want to refresh us with your answer.
I'm sorry, can you repeat the question?
Sure. is it mandatory to carry immunization records? Also, what vaccinations are we supposed to get before entering the US?
Okay, so
You
I
want me
think
to
Lee
answer?
talked.
Okay.
Yes. That's very important.
Yeah, so again, if you want to keep a copy of your vaccination records on you, that's fine. That's really up to that's at your discretion. And there are the only required vaccinations are meningitis if you're 22 or younger, and the TB screening. Other than that, we have recommended immunizations. And again, that's up to you if that's something that you want to partake in. But other than that, definitely having a copy of your vaccination record could not help, because you may have to go to a local hospital for services, and maybe they want to know what you've been vaccinated for. And if you have that on your person, you're able to share that. So it does not help to have that handy, just, for whatever reasons may pop up.
Right, I see. Okay. All right, here's another question. This question says, if I get the TB test on August the 22nd, will I be allowed to attend classes on August the 23rd, since it takes 48 to 72 hours for updates?
The answer to that is yes, because you will have fulfilled. I mean, unfortunately, there's nothing we can do. Medicine takes time a little bit. So yes, you could definitely attend class because you will have fulfilled that requirement. However, if we notify you that the results are positive or we need you to follow up, then we need you to contact the Student Health Center as soon as possible so you can kind of see what the next steps are.
Okay, thank you. Okay, and here's a question. This question says, can I take a COVID test? Can I take the COVID test on a weekend once we arrive in Dallas? So maybe this is just more asking about the testing availability as to whether or not they're available on the weekends.
I do not know the schedule. I know they're working that out right now. I want to say yes, because I know some people are coming in on the weekend, but definitely just kind of keep your eyes open for emails that kind of give you the updates for the scheduling. In the past, the location on campus has been open on the weekend for limited hours, but I'm not sure what they're going to do for the fall. Outside of our university, there are tons of locations nearby that give it, but I just don't want you as a student to have to try to navigate Richardson to figure out where it is. But I can definitely bring that up in a meeting that I have today, just to kind of make sure that that's an option for students that are arriving on the weekend. I think that would be, just good for you. So that when you come in, if you want to take care of it upon arriving, then you've kind of met that 3 to 5 day window.
Okay. Yes. And to all the students who are listening, we definitely understand arriving to UT Dallas and kind of beginning or continuing your academic and professional journey is very important, and there are a lot of decisions that you have to make when you have to make arrangements to sort out where you currently are to move your whole life to a completely different country, miles away. It really does take a lot of coordination, and please know that we are very much aware of that. UT Dallas has a long history of hosting and taking care of and serving international students. We are only but a young, 50 years old, but we have the largest international student population in the state of Texas for a reason. So we have precedents for managing and coordinating everything that is required to serve our students. So I preface that to say, please understand that we're definitely doing the best on our end as well to prepare for the arrival of students. It's not something that is new to us. We have a history of doing that very successfully, as hopefully you already know. But COVID is still a situation, and it is, a thing that is also evolving as well. And so with the planning that we're doing, we also have to consider a virus that you pretty much, you know, have to watch patterns and trends and all of these things. So please understand that we definitely empathize with, you know, wanting to plan and coordinate and everything. And we are definitely supporting you in that effort. That is why we have these information sessions that we share, and we have the various offices come by and, you know, share information so that you can help to make decisions and plans. But I also know that, you know, we are also planning ourselves, but we also are planning in a pandemic, if I could say that. So we definitely are aware of your student needs, and thank you for your questions, because your questions actually show us where we need to be focusing on and, you know, what areas we need to be addressing. But please know that if we're not able to give you maybe a certain answer that you want to hear, or maybe a bit more of a specific answer, it is because, you know, we are answering the best answer that we have given COVID, and you know, we don't want to tell students something and then it doesn't happen to doesn't turn out to be the case. And then also we really want to protect lives and safety of the UT Dallas community. So I just want to thank you so much for your patience and your understanding as we are returning the same understanding towards you as well. But we definitely thank you for choosing UT Dallas, because there's so many options and choices for universities in the United States, as I'm sure you all know. But we're definitely planning to welcome you into the United States, into Dallas, into Richardson, and we know that you're going to enjoy your studies with us. Okay, so before I go on anymore, I think we have really gotten to quite a bit of the new questions that are in the chat, and I think we're actually coming towards the end. Maybe Brenda or Leah, do you have any closing thoughts or final things that you would like to share with the students who are listening?
Brenda, did you have anything? I didn't want to jump in front of you.
I think we discussed a lot, but again, it was a lot of information. So again, if there's any questions, you can send us an email at stuhealthinsurance@utdallas.edu. You can also give us a phone call, but we are experiencing, you know, a lot of calls right now, so it may be easier, even faster, to email us. If when you're emailing us, please provide us with your UTD ID number, just because it cuts down the number of emails I'll have to send you back if you just include it in your first one. And then our website is also a huge resource, UT Dallas /insurance. There's a lot of information on there. We post all our deadlines, our coverage information, so that's also a great resource. But again, if you have anything, you can just reach out.
And I just want to add, I know, one, thank you for all of your questions. I know it's just a lot of information to navigate. Just know that any questions that you may have, I know they'll get asked a ton of times. We'll definitely have the patience to keep answering them, and you know, just making sure that you guys feel confident and safe about the information that you're getting. You all have, for most of you who have already scheduled your TB screening, I forgot to mention this earlier, you have experienced one of the ways that you can make an appointment with the Student Health Center. So you can do it online, you can do it by phone. Again, we're limiting our traffic in the Student Health Center. We are going to be one of the few departments on campus that will require students to wear a mask and call upon arrival. Again, that is just to continue enforcing social distancing within our office and to keep our staff and our students safe. But just know the university has done a good job, as well as the departments that are represented on this call, of just making sure that we try to keep you guys as informed as possible as it relates to COVID and just arriving to campus in the fall. We're excited about returning, and we definitely want to make this a very good experience for you as well upon arriving to campus in the fall.
Great, thank you so much. And once again, I just posted some links in the chat, so I highly recommend for you to visit these links to read the information. A lot of the questions that were posted I think after reviewing the information from those links, I think a lot of those questions could be answered that way. And if there are additional questions about scheduling for the TB test, COVID test, the contact information is on the screen for the Student Health Center. And their email is also in the chat. It is healthcen@utdallas.edu. So thank you to everyone once again for joining us for today's healthcare in the United States. We wish that everyone will continue to stay safe and be well. And we will see you next time on our next orientation event. Take care, everyone. Goodbye.
Thank you.
Thank you.